Good morning and welcome to Access Health. According to the Institute of Medicine, more than 100 million Americans suffer from chronic pain, affecting more individuals than diabetes, heart disease, and cancer combined. Today, we're taking a closer look at living with chronic pain, with experts in their fields sharing new hope to help improve patients' quality of life. Access Health starts now. Whether it's working out, running up and down the stairs, or just getting out of the chair, all of us are bound to experience some aches and pains at some point in our lives. The fact is that our joints wear down as we age, which often leads to pain, loss of mobility, and a decrease in physical activity. What can we do? Well, it turns out what might be the best thing we can do to keep moving is keep moving. And here to explain more about those aches and pains and what we can do instead of just grin and bear it is Dr. Tracy Ray, a primary care sports medicine physician from Duke University. Welcome, Dr. Ray.
Thanks for having me.
I just turned 40. I'm as active as I possibly can be. For a while now, I've been feeling significant aches and pains. Is this just something that comes with age, or am I truly wearing down my joints?
Well, there's a lot of things that can cause aches and pains. And as we get older, certainly you will feel more of those aches and pains. I think everybody realizes that. I think the difference is that it could be some wearing down of your cartilage. It could be something we call osteoarthritis, and it can affect a lot of different joints.
Can you describe what exactly is osteoarthritis?
Osteoarthritis is a wearing and tearing of the surface of your joint. The part that's wearing and tearing is called articular cartilage. And that can be due to a previous injury or a previous surgery, but it also can come from just a lifetime of being active and being weight-bearing on your knee.
Is that primarily where we see osteoarthritis?
It really is. In my practice, I see probably more arthritis in the knee than I do any other joint. It certainly can happen in any other joint, but it seems like the knee and pain in the knee can be the thing that drives people to come see me more than anything else.
So what specifically are the symptoms associated with knee osteoarthritis?
Well, overwhelmingly, I think the biggest symptom is just going to be pain. And a lot of time that's pain with motion and can lead to a loss of motion. Occasionally, patients will notice some swelling in their knee. It might be red or warm. And activity oftentimes can be a trigger to that pain just because of the bearing of the weight that you do through your knee joint.
I know often I hear this popping or that cracking or that grinding. Is that also a symptom of osteoarthritis?
It can be, but it's not necessarily so. In my office, I explain to patients all the time that when you tell me about how much noise you're making with your joints, it doesn't really indicate whether there's damage there or not.
I think the first thing you do when you experience some sort of pain is just stop movement altogether. And there really are consequences to not moving and living an active life.
It's very natural to react to pain in a joint by backing away from your activity. It's when that backing away from your activity extends into more of your lifestyle. You don't go to the gym because your knee hurts. And that can lead to inactivity, which of course can lead to being overweight, which then just makes the knee pain even that much worse. So not only are we talking about joint health, but we're also talking about your general health. And becoming inactive can lead to a lot of problems: diabetes, hypertension, and a whole list of medical problems.
Including insanity.
Including insanity.
In my case, at least. As of now, what is the sort of standard care for managing osteoarthritis of the knee?
Physical therapy is often part of that. Medicines that you take by mouth or that you rub on the knee. Bracing can often be a component of the care. Ultimately, it gets more invasive with injections. And if you fail all that, then you may be talking to a surgeon about having your knee replaced.
Knee replacement seems pretty severe. Is there another approach?
A lot of folks in medicine, and sports medicine in particular, are really looking towards emphasizing a return to activity, basically a conservative care approach based on the idea that motion is medicine, and we call that motion care. It aims to help people restore motion, get them moving, or keep them moving. And the treatment options that we're talking about optimize the patient's activity level. We need to address 4 barriers to allow the patient to remain fit, healthy, and active. Those 4 barriers are essentially that we need to look at and address the patient's pain, keep the body in motion. Number 2 is alignment is crucial that it's correct, because any kind of malalignment can cause more pain and more wear and tear on the joint. Third is strength, allowing the patient to continue to be active. We can maintain strength, and that's going to be key to all the muscle groups that are important around the knee. And finally, stability, to explain real or perceived instability and allow the patient to be confident as they move freely.
It sounds amazing, but what tools do you have to sort of overcome those barriers?
So fortunately, DJO Global has given us some access to some evidence-based products that work with a motion care treatment plan to help maintain or achieve motion. One example of that is the DJO Global Reaction Web Knee Brace, which provides shock absorption and anterior knee pain relief to decrease knee pain and increase function. The innovative elastomeric web that is on the front of the brace is an innovation that helps to absorb shock, disperse energy, and shifts the pain away from the knee, and it allows for balanced movement and alignment. Ultimately, it gives confidence so that the patient can move freely.
This feels like no brace I've ever felt before.
It's using a lot of newer technology and newer materials, even the engineering of the brace with the web design on this brace to try to allow the kneecap to track better, to try to diminish the amount of pain that you have in your knee so that you can do the physical therapy that you want to do and remain active like you want to be.
Really innovative technology that provides real solutions.
Well, it is innovative, but it would be really important to seek out your own physician to make sure it's right for you.
Of course, and thank you, doctor, for coming.
You're very welcome.
For more information about the Reaction Web Knee Brace and other motion is medicine technology, go to djoglobal.com/motion care or just log on to accesshealth.tv. Welcome back. On a previous show, we discussed chronic wounds and the effects they have on a patient's quality of life. This issue is still very relevant today, so we thought we'd revisit. Take a look.
Oh, I love the blues. I kind of grew up around the blues. I live it. I love listening to it. I love playing it. I went to high school in New Orleans. Went to Berklee College of Music in Boston, graduated with a degree in instrumental performance. I was a professional musician, played all over the United States, and I'd like to get back to that. I've also been in the construction trades and built some pretty major projects all over the United States. Well, I used to be in great health, but in the year 2000, I came down with pancreatitis, and it really screwed me up bad. My diabetes went out of control pretty bad and gained a lot of weight, had a lot of medical problems. In 2009, I had a pretty horrific diabetic wound on my right foot, and I became permanently disabled. I have not worked since 2009, and I've been fighting a multitude of wounds on my feet and my legs, and wounds from various falls and slips from being handicapped. I just want to go back to being a regular person.
Everyone has the occasional minor bump or bruise that we slap a bandage on. But if you underwent surgery or you had an accidental burn injury or you have a specific wound-related medical issue like Terry, then you've had to deal with advanced wound care. Turns out that a lot of people, an estimated 17 million of us, will struggle with the difficulties of wound care this year. So joining us to talk more about wound care is Terry Young, along with registered nurse and board-certified wound care specialist, Dot Weir. Thank you so much for joining us. We have a lot of important things to talk about today. So Terry, I'd love to start with you. Tell us a little bit about the struggles that you deal with when it comes to wound care.
First and foremost, there's a whole lot of pain and physical and psychological trauma associated with all that. Your whole life changes because you become a professional patient. you can't work anymore, you're at home, you're not making any money. All phases of your life change in the most profound way.
I want to thank you, first of all, for coming and sharing, because I think that's very important for everybody out there. So thank you so much, Terry. So Dot, I know that you've been working as a wound care specialist for now almost 40 years. You work on the team that helps take care of Terry. In your opinion, what are some of the challenges that you see with wound care on the medical side?
Well, the medical side brings all kinds of challenges. First and foremost, we're dealing with a disease state that has caused a change in somebody's skin, or they have developed a wound or had a trauma that now their disease state takes over their ability to heal normally. All of us are used to healing thoughtlessly, that we don't have to put any effort into it. But folks like Terry, when they have diabetes and other disease states, there's many reasons that people have wounds, are challenged with healing. And so they have this necessity to have dressing changes done on a daily basis and create an environment for healing that we have to emphasize to them is necessary.
And I know, Terry, you've talked a little bit to me personally about how you can make advancements and you feel like you're healing, and then so simply you can take one step forward and then 2 steps back.
With most normal people, it just takes a few days for a wound to heal. It might take me weeks or months. In some cases on my feet, it's taken years. So any setback is horrendous, and any advancement with different kinds of medications or treatments or bandages helps so much for somebody like me. I mean, you don't know it until you've lived it.
Truly, it's been an emotional and psychological struggle for you until you came across this product. It's called SafeTech, right, Doc? Can you tell me exactly what is SafeTech?
SafeTech is a technology that is our first introduction into reduced pain and trauma with wound healing and with dressing changes. Something we had thought about before, but they really brought it to the forefront of people who do wound care like I do, to have us start thinking about how much we're hurting these people when we change their dressings. So it's everyone has had something adhesive on their skin, and we know that when it pulls up, it pulls hair, it's pulling on skin cells. So doing that repeatedly, like with someone like Terry who has to do frequent dressing changes, 1 or 2 or 3 times a week, you're going to strip the skin and cause injury. So with this, it's adhering with silicone, and the silicone sort of goes down and in amongst the skin cells so that when you take it off, you're not stripping anything. The silicone does not adhere to moisture, so it doesn't pull off the healthy tissues that are trying to grow in the wound. And then it also creates a moist environment by absorbing the exudate, but protecting the peri-wound skin. So it's not pooling drainage, or we call it exudate, but drainage on the skin, which will further damage the surrounding skin. It causes a situation called maceration, which is just over-wetting of the skin, but it can destroy good, healthy skin, so it's something that helps us to prevent that as well. Something I've always felt about wound care is we only have one opportunity to hurt somebody. If it hurts when we do it, they're not going to trust us, they're not going to want to come back. And so if we can use something that will reduce that pain at dressing changes, it won't be something that they dread.
So is this something that only you have access to at the hospital?
No, actually that's the beauty of it. It is now a product that is available to the general public. It's the first time this advanced type of dressing is available at retail pharmacies so that patients can have access to it certainly with the guidance of their healthcare professional, but have access to at their local drugstore.
With this sort of a product, is it helpful with the pain relief? Does it require less pain medication potentially if you're relieving the pain?
Well, there's absolutely a lot less pain by using this product. I take it off, I clean up the wound, I put it back on, and life goes on.
And so as a result of less pain with dressing changes, there was a study done that actually looked at the fact that over 70% of the folks that were using this technology took less pain medication. And pain medication, while it is a necessary evil, it affects your whole life. Your ability to drive, work, you're sleepy all the time, your appetite is less. So the ripple effect of pain definitely negatively impacts wound healing.
So how has it improved for you now that you have SafeTech?
Well, it makes my daily care so much easier. It's to the point where I can clean it up at home, put something clean and sterile on, and I know I'm not damaging something that I've spent a lot of money trying to get to heal, that I don't go back to square one all over again. It makes me much more confident to take care of a problem at home on a daily basis.
Thank you so much, Terry, for joining us, and Dot, thank you for all the great information. Where can we learn more about SafeTech?
Well, you can go to safetechathome.com, and that's SafeTech, safetechathome.com.
Thank you so much. Again, you can go to safetechathome.com to find more information about their technology, or just log on to accesshealth.tv.
The healthcare community's fight against cancer is leading to increased survival for patients, which is encouraging to hear. However, it's important to recognize some problems that can arise when a patient with cancer lives longer. Dr. P.K. Morrow, an oncologist and the Executive Medical Director of Global Development at Amgen, explains one such problem: what can happen after cancer spreads from a solid tumor to bone.
Cancer can spread to different portions of the body, but bone is a common site. Generally speaking, all cancer patients are at risk for cancer spreading to the bone. However, patients with breast, lung, and prostate cancer are at a higher risk for cancer spreading to the bone.
When cancer from a solid tumor spreads to a bone, this is called bone metastasis, or bone met for short. Dr. Morrow explains.
A bone metastasis, or a bone met, is where cancer cells spread from the original solid tumor to live in the bone, where they can cause serious bone problems. That's very different from bone cancer, where the cancer cells originate within the bone itself. Bone mets can usually be confirmed by a bone scan. Bone metastases oftentimes spread to the center portion of the body, which includes the skull, the upper arm, the ribs, the spine, the hip, and the upper leg. Bone metastases can cause serious bone problems, which is why we need to spot them and discuss them as soon as possible.
Serious bone problem is a term used to describe certain troublesome events related to patients' bone health that can occur when a bone met is present.
Serious bone problems are broken bones, a need for surgery to prevent or repair a broken bone, a need for radiation to treat bone pain, or spinal cord compression, which is described as pressure on the spinal cord, can result in decreased sensation or impaired mobility.
There are certain troublesome events related to a patient's bone health that can occur when a bone met is present. Dr. Morrow describes some of the problems for us, as well as some of the telltale symptoms to watch for.
Worsening or new bone pain can be a sign of a serious bone problem. Numbness or weakness around an affected bone, or even bowel or bladder control changes. But there are other symptoms, which may include sudden severe pain, pain that prevents you from moving, pain in your back or neck, difficulty urinating, constipation, lack of bowel or bladder control, numbness, weakness, paralysis.
Many early-stage cancer patients say that their diagnosis came as a shock and that they have not experienced any symptoms at all.
Patients can have bone mets, which can lead to a serious bone problem without even experiencing symptoms. For example, a patient could have a bone metastases that can lead to serious bone problems without having any bone pain. That's why if patients are concerned about bone problems, they should talk to their physician about their risk of bone problems and whether they'd be appropriate for a bone scan or another imaging test. Bone targeting medicines, or sometimes called bone targeting agents, can help to prevent serious bone problems. Bone metastases impair the body's ability to rebuild bone. What these bone targeting agents do is they help to restore that balance. These agents are given every 3 to 4 weeks by intravenous infusion or injection. As with any medication, there are potentially serious side effects. These bone targeting medicines can cause dangerously low calcium levels, also called hypocalcemia. Your doctor may recommend calcium and vitamin D supplements to help prevent this side effect. In addition, osteonecrosis of the jaw, which is bone damage in and around the jaw, can occur in patients taking bone targeting agents. Patients can also experience unusual thigh fractures. Proactive treatment, if you're at risk, is extremely important. Talk to your doctor about your bone health, about whether you should get a bone scan, and whether taking a bone targeting agent is appropriate. Studies have shown that without a bone targeting medicine, patients with bone mets may experience a serious bone problem within less than 1 year.
Thank you, Dr. Morrow, for all of the insight. I just want to take a moment to acknowledge the friends and family who stand by patients in their fight against cancer. As a source of encouragement, caregivers offer unrelenting support in so many ways, such as going along with them to appointments, asking nurses and doctors about topics like bone health, or simply being there. So we say thank you. And for more information, you can visit us at accesshealth.tv.